Fatty fish, including species such as salmon, mackerel, and sardines, are rich sources of omega-3 fatty acids, specifically eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. These essential polyunsaturated fats have gained recognition for their potential role in reducing the risk of stroke. This section explores the stroke prevention effect of fatty fish by examining the underlying mechanisms and summarizing the scientific evidence supporting their inclusion in a balanced diet. Mechanisms of action. The beneficial effects of fatty fish on stroke prevention can be attributed to several mechanisms. 1. Anti-inflammatory properties. Omega-3 fatty acids possess anti-inflammatory properties that can help reduce inflammation in blood vessels. Chronic inflammation is associated with atherosclerosis, a major risk factor for stroke. By reducing inflammation, fatty fish may help maintain healthy blood vessel function and reduce the risk of stroke. 2. Blood pressure regulation. Omega-3 fatty acids have been shown to have modest blood pressure lowering effects. High blood pressure is a significant risk factor for stroke, and by helping to maintain optimal blood pressure levels, fatty fish may contribute to stroke prevention. 3. Antiplatelet and anticoagulant effects. Omega-3 fatty acids can help reduce platelet aggregation and inhibit blood clot formation. Blood clots are a common cause of ischemic stroke, where a clot blocks blood flow to the brain. By inhibiting excessive clotting, fatty fish may reduce the risk of ischemic stroke. 4. Improved lipid profile. Omega-3 fatty acids can increase high-density lipoprotein, HDL, cholesterol, commonly referred to as good cholesterol, while reducing levels of low-density lipoprotein, LDL, cholesterol and triglycerides. This favorable lipid profile is associated with a decreased risk of atherosclerosis and stroke. Scientific evidence. Numerous studies have investigated the association between fatty fish consumption and stroke risk reduction. 1. A large-scale study, the Nurses' Health Study, observed that women who consumed fatty fish at least twice per week had a lower risk of stroke, particularly ischemic stroke. 2. The Japan Public Health Center-based prospective study revealed that higher intake of fish, including fatty fish, was associated with a decreased risk of intraparenchymal hemorrhage, a type of stroke caused by bleeding within the brain tissue. Practical recommendations. To incorporate fatty fish into a stroke preventive diet, consider the following recommendations. 1. Aim to consume fatty fish, such as salmon, mackerel, and sardines, at least twice a week. 2. Choose fresh or frozen fish over processed options like fish sticks or fish patties, as they may contain added sodium, unhealthy fats, and preservatives. 3. Opt for grilled, baked, or steamed preparations rather than frying, as this helps retain the nutritional value while minimizing the addition of unhealthy fats. 4. If you have concerns about mercury or other contaminants, consider consuming fish varieties with lower mercury levels, such as salmon, trout, and sardines, while limiting intake of larger predatory fish. 5. If you are unable to consume fatty fish regularly, consult with your healthcare provider about omega-3 fatty acid supplements derived from fish oil.